President Paul Kagame unveils IRCAD Africa Center of Excellence in Rwanda hails collaboration. President Paul Kagame on Saturday launched the IRCAD Africa Center of Excellence in Masaka, Kicukiro district, and hailed the partnership between IRCAD and the government of France, which birthed the state-of-the-art medical training facility. The head of state and the First Lady, Mrs. Janet Kagame, were the guests of honor at the inauguration of the Training and Research Center in minimally invasive surgery, which is expected to be a game-changer in Rwanda's health sector. Speaking at the launch of the groundbreaking initiative, which aims to catalyze surgical innovations, promote skills development, and improve patient outcomes across sub-Saharan Africa, President Kagame said that the IRCAD Center in Rwanda is timely investment which the continent needed. He hailed the collaboration between IRCAD Africa and the government of Rwanda to set up the center, which will serve as a world-class facility for training and research, fostering collaboration and knowledge exchange among surgeons, physicians, and healthcare professionals from across Africa and beyond. President Kagame said that the launch of the center is a sign that if Africans partnered with other players globally, similar initiatives that contribute to the development and investment in the health sector. It is a great day in many ways today, President Kagame said, giving a background of how the collaboration came about, commending Professor Jacques Morsco, the founder and president of IRCAD, for choosing Rwanda to host the center. He pointed out that the center is not built for Rwanda alone, but Africans and other medical practitioners from across the world to visit, learn, and share knowledge. President Kagame said that Africa should not be seen as part of the world that remains behind in terms of advancing and developing in all sectors, particularly the health sector, which continues to lag behind. He thanked Professor Morosco and Dr. King Kayondo, President IRCAD Africa, for considering Rwanda to host the center, pointing out that IRCAD and Rwanda share the same vision of trying out new efforts to improve the well-being of the people. He said that the center will equally play a key role in exposing Rwanda's and Africa's talent, who will benefit from the center at much higher level and standards to grow in their fields. When I first entered this room, I first wondered whether I was in Strasbourg, President Kagame said, in reference to the center's headquarters in France, which he visited before. We are very happy to be associated with this way and any other way because of what this stands for, President Kagame told Professor Morosco. The training program in minimally invasive surgery that we have come to fully understand and see effects of in many ways is something that is going to change lives to a very high degree, President Kagame said, thanking all who contributed to its development. President Kagame and other guests, he pointed out that the launch of the facility shows that Africa can indeed invest in health and medical infrastructure and have returns. This encourages us to keep investing significantly in public health infrastructure and knowing that there are no limits in terms of quality, and therefore we should also make sure that there are no limits in terms of quantity so that it goes around and reaches everyone as it should be, he said. President Kagame said that the center will not only bring together the best minds and talents from across Africa, but also from the entire globe to leverage the tools it offers to improve medical services. The launch of the IRCAD Africa Center of Excellence is seen as an innovative addition to Rwanda's ambition to become a medical and health hub, and also represents a major milestone in the region's healthcare landscape. The establishment of IRCAD Africa is the result of the strategic partnership between the government of Rwanda and IRCAD France, a visionary institution renowned for its expertise in laparoscopic surgery. The partnership combines global surgical excellence with local knowledge and expertise with the intention to help create a sustainable and impactful center in sub-Saharan Africa. Government of Rwanda invested in the construction of the center in Masaka. For the first 5 years of the partnership, the government of Rwanda and IRCAD France committed to fund the center's operations and running costs. The memorandum of understanding between the two parties spelled out a separate 50-50 percentage cost sharing investments. Rwanda was chosen as the home of IRCAD Africa, offering a propitious environment. The country's commitment to invest in health and geographical location were key factors. Rwanda has already invested in advancing invasive therapies, with a couple of hospitals already practicing the surgery procedures through diverse programs, preparing the ground for the establishment of IRCAD Africa. These techniques offer numerous benefits to patients, including shorter hospital stays, reduced pain, and faster recovery times. By acquiring surgeons with these skills, IRCAD Africa aims to improve surgical outcomes and elevate the overall quality of healthcare in the region. The facility will also feature cutting-edge simulation technology, including virtual reality and augmented reality platforms, allowing surgeons to practice and refine their skills in a safe and controlled environment. Additionally, the center houses a fully equipped operating wet lab, complete with advanced surgical equipment, enabling hands-on training in real surgical scenarios. The launch of IRCAD Africa Center of Excellence represents a turning point in surgical education and practice in Rwanda and Sub-Saharan Africa. By combining international expertise with local context, IRCAD Africa will empower Rwanda and Africa surgeons to deliver the highest quality care to their patients, enhancing the region's surgical ecosystem and fostering innovation for the benefit of all Africans. To facilitate continuous learning and knowledge exchange, the IRCAD Africa Center of Excellence earlier this week launched its first surgery course at Masaka, attracting more than 60 participants and surgeons from over 20 countries, bringing together 4 surgical experts, leaders, and innovators from around the world. The courses feature interactive workshops, live surgeries, and scientific sessions, creating a platform for sharing best practices, discussing novel techniques, and advancing surgical research.
Wow. First of all, it's a great day in many ways today. Let me start by thanking Professor Jacques Marescou, founder and president of IRCAD, Dr. King Kayondo, IRCAD Africa president, Dr. Guillaume Marescou, IRCAD Africa vice president, faculty staff and supporters of IRCAD Africa. I'm very pleased to join you and welcome you to Kigali, which you have built in a way. Kigali, our capital city, is not just for Rwandans, it is for Africans, it is for friends from across the world, and people from who are the family of IRCAD and IRCAD Africa. We want you to feel that you are our family as well. So you're most welcome. So many things have been said. You know, for me personally, I have not been with the opportunity to be of a very significant talent in any field. But what I tried to do, I created an idea that maybe since I'm not talented in many things, I developed an idea that I should be talented in managing talent of others. So that's what enables me to, through friendship and what was said earlier, thank you, young Marescou, to remind me we have a history, Rwanda's history weaves through all this that was said. First, for our country, every yesterday was expected to be the tomorrow. So, and that's how we were in one place of underdevelopment for a long time. Because what was yesterday was what was expected tomorrow. So we reversed the trend. We tried to say, how about having tomorrow as yesterday? Reversed to two things here, and the parts of the history I really want to speak to. While what has been happening in the past was expected to be happening in the future, we wanted to see the future as having arrived in the past and in our background and being something new. So that's how we came to embrace doing things in a manner that we have come to be used to. I remember in 1998, some of my friends who are into technology globally, in 1998, when we were trying to rebuild the country and we were talking about using information and communication technology, and so one of these friends, a very rich person and who is into technology, asked me, said, why would you be thinking of investing your nothing, more or less, because you had nothing, into technology when your people are starving, they have no health, they have no all kinds of stuff. And I told them, well, first of all, it was a group but led by one of my friends. I said, that's true. Our people are starving anyway. Our people have no good health. That's all true. But does keeping away technology really give them food? So I said, we are trying to invest the nothing, the little we have, in a way that we divide it and spread it to cover food and cover health, but to cover technology which cuts across all of them. I saw somebody use the multiplier effect term. I said, technology has a multiplier effect. It doesn't take away anything from anybody in any case. So that's how we started developing this idea. And now I'm leading to saying, Professor Marisco, if could have chosen to go somewhere else, not in Rwanda, and that's the story he told. I wanted to thank you for taking the risk in trusting us. But I think maybe it is high risk. It has also become high reward, because it has benefited the Rwandans in a way probably you will never realize, and the Marescos and the others who work with you at IRCAD International and others who join you because they understand the cause and the vision you have, but more so the vision to use the tools to advance knowledge, to advance technology, and to bring it to places where it is not expected. Because, many people, once they say for this, they say, well, Africa, in many cases, is not deserving, or it comes as a second thought, as an afterthought every time in many conversations. But the fact that you said, no, this is not going to be an afterthought, but let's take it to Africa. Well, and above all, that's why I called it high risk. In Africa, you chose Rwanda. There must have been something that was connecting you with us to believe in us and but it was to try and close these gaps that have existed with our people, the people of this country, the people of the continent, and others on other continents. I think it was a combination of value and values. So I wanted to specifically thank you for that, and you will not be disappointed. Even at a personal level, you feel that what you invested in has had a huge effect in changing many people's lives through improved and access to health and of a certain high level that was not expected, that people never thought about. So my other pleasant thing here is that what you have created in this IRCAD Africa indeed is not serving Rwanda alone. It is serving Africa, and it is also improving and taking beyond the talent we have in Africa to a much higher level. I'm sure you've seen those who have been here coming from across Africa, of a very, very high standard in their fields and area of talent. So bringing people together and bringing them together in our country here and around this center of excellence has limitless value in our understanding and feeling. So when I entered this room, I first wondered whether I was in Strasbourg, because when you invited me and came to Strasbourg to IRCAD, and had the pleasure and honor of being honored there by being recognized in a way you did. We are very happy to be associated in this way and in any other way because of what this stands for. The training program in minimal invasive surgery that we have come to fully understand and see the effects of in many ways. Is something that is going to change lives to a very high degree, and again, you should be thanked for that, all those who have contributed to not only its development, but also to mainstreaming it in the practice of surgery and the effects it has had on health. So you were saying, talking about being Rwandan, I invite everyone here, wherever you have come from, to be, as I said, we are a family, so you should be Rwandan in all senses, I mean. If you want a passport, the next day you can have it. And maybe Minister of Health the next day. I'm not threatening your job. I'm only saying you could have 2, 3 ministers or 4 in addition to your position. And this encourages us to keep investing in significantly in public health infrastructure, and knowing that there are no limits in terms of quality, and therefore we should also make sure there are no limits in terms of quantity, so that it goes around and reaches everyone as the case should be. Let's continue bringing together the best and the brightest that we have, especially across Africa, in Rwanda, and working with those from across the rest of the world. That's how we can build a better world for all of us to live in. So I really just came here to express my gratitude and promise that we will work with all of us together the rest of the journey that is ahead of us, that is long, and with people like there are in this room, I think we can keep making tomorrow yesterday. Thank you very much.